Hi there. I'm Dr. Julianne Flynn, Chief of Staff at the South Texas Veterans Healthcare System. Today I'd like to talk with you about some of our performance improvement efforts. To quote our director, Mr. Sandals, right now we're a very good healthcare system, but we also have the potential to be an exceptional healthcare system. We will achieve this through our constant and consistent focus on performance improvement. I want to step back first, though, to talk about the meaning behind the numbers, because I want to be sure we are focusing on the right things, always. We know that the VA measures, well, pretty much everything. The fact that we measure everything can sometimes be kind of overwhelming. But really, this puts us in a great place as we reinvigorate our lean approach to improvement and as part of our high reliability organization journey. And what is behind the numbers at the end of the day is really the safety and quality of the patient care we provide day in and day out. I'd like to give you an example. Why should we care about our health effectiveness data information set, also called HEDIS? These measures were developed by the National Committee for Quality Assurance to measure the quality and effectiveness of healthcare. They include important preventive medicine items such as colorectal, cervical, and breast cancer screening, all of which can help us to catch diseases early when they are still very treatable. Other measures focus on care for veterans with cardiovascular disease, diabetes, and mental health concerns, and are similarly targeted to assure we provide the best care anywhere. If you're wondering how we do on these HEDIS and HEDIS-like measures, we do really well. Kudos to all the care teams for the strong work you all are doing. And a special shout out to our primary care PAC teams as they have the heaviest lift with this work. There are other areas we also do well in, including aspects of our inpatient care, such as Oryx. Oryx was developed a few years ago by the Joint Commission, again to assess the quality and effectiveness of the healthcare we provide. Where we really struggled a couple of years ago on these, we came together to turn it around, and we did it. I am so proud of the outcome and of the exceptional teamwork that continues to this day. I think our employee engagement and teamsmanship really are some of our biggest strengths here at South Texas. I can think of so many examples of exceptional teamwork. Our heart failure work group is one. It was stood up years ago when our readmission rates were high and has continued to this day, and our readmission rate has remained steady. The group is also working to address ambulatory care sensitive conditions, those conditions that can best be treated as an outpatient, and has researched best practices for care, helping to advocate for a new complex care team. The team is now on board and will case manage our patients who have been admitted more than 3 times in the past year, providing very close follow-up to reduce hospitalizations. The work of our clinical care teams, infection prevention, patient safety, quality management, nursing, and many others really speaks volumes and is indicative of what we can do moving forward. We continue to be a leader in the nation when it comes to HEDIS and Oryx. When we look at how we compare on the CMS Hospital Compare database, we outperform not only on a national level, but on a local level as well. Now, I want to also speak to our challenges and the subjects we will be focusing our improvement efforts on as we strive to be a leading 1A healthcare system. These issues include our acute care mortality measures, also called SMR and SMR30, utilization management, some mental health measures, and some areas of our outpatient veteran experience. We have improvement plans for all of these, and I'll share a few with you now. First, acute care mortality. We have chartered a project team that will ramp up their work this month. By expanding the way we already assess our surgical mortality reviews, this interdisciplinary team will do a deep dive look at our mortalities. The team will look at all aspects of the data to develop a detailed improvement plan. We may learn that we need more specific and tailored care pathways. As an example, We also may see whether our documentation and coding are reflective of the complexity of care we provide. A second emphasis is utilization management. Our utilization management measures are tracked through our patient flow committee, and we are currently below the national average on these. The team has recently added CDI educators and is actively developing and piloting ways to improve, so we ensure we have the right patient in the right level of care to meet their needs. I expect great things from these endeavors in the coming months. A third area we are addressing involves our mental health services. Mental health has been able to expand some programs to address the increasing demand for specialty services, but there are still challenges here. We are working to improve the continuity, population coverage, access, and veteran perception of care in mental health. We're excited to be adding more substance use disorder and recovery initiatives and have big plans to develop and open an intensive outpatient program in the next few months. Finally, improving our outpatient veteran experience will involve all of us. Our patients' perception of their experience on the inpatient units has improved and been sustained in recent years. Still, we continue to struggle with our outpatient veteran experience, especially in mental health and primary care. Our veterans' perceptions on access in particular is an area I expect us to work on with laser-like focus this year. In closing, I'm confident that we will not only continue to improve in the areas mentioned, but that we will also sustain the headway we have made to date on all our important patient care initiatives. We have all we need to truly be one of the exceptional healthcare systems in the VA. And with all your help, I know we can achieve this. I'm honored to serve as your Chief of Staff and your teammate in this important work.